first thing you see is a person. You see a human with a whole, with a body, with the energy that he brings to the office, and only then you begin to speak to the patient, to the person, and then you go layer by layer. The mind more or less always really blocks the emotions, the psyche, the being, the intuitive part of a person. Many times I say that only in the fifth or even later visit we truly know about the person, so he tells us what he is experiencing, what he's doing. Well, our clinic is the kind of a clinic where the complex patients come. So immediately we are involved, at least two, or actually three of the doctors or therapists. So we have a dentist, we have a biological therapist or expert, and we have the Ayurvedic doctor. And I would say that 99% of our patients see all three of the doctors. And very, very often I also include the psychoanalysis or psychotherapist into the whole picture. It can be right in the beginning or later on. I must say that only then we can really expect a recovery on all aspects of human being in even the most complex cases. I don't want to use the hypocrisy because it has been said so many times, but the food is the first medicine. So there is no device on earth, no approach on earth that can cure you long term if you eat wrong food. Huge step that people need to make, the patients need to make, is to change the way they cook. In the modern days, kitchen is all about the eyes, so it's the plating and the taste. But nobody really asks themselves what happens to the food once they swallow it. Does it support you? Does it heal you? Does it give you energy? Or is it just something that then you need coffee right after? That's the main question one should ask himself or herself. The meal should give you energy. After the meal, you should be full of energy. That's the basic idea, and you can be. So the treatment will be successful if I feel you and you feel me. And somehow just naturally that aligns itself during few visits. So if the patient doesn't feel what we are doing, or even if I don't feel, maybe I say also, I think it's a better solution that you look for another therapist, because it has to be the alignment between the doctor, the therapist, and the patient. It needs to be this psychic, intuitive alignment in order for the treatment to be successful. And I think that most of the people can relate, and it's not such a big issue. There are many approaches existing on earth. It's pharmaceutical, it's Chinese, it's Indian, it's biological medicine, it's many modalities, it's herbal, and I think that for each person there's a system that will work in the end. I'm here where I am because I always listen to my intuition. So I remember clearly, I could show you the apartment, the student apartment in Ljubljana, the table where it was situated, and which book I had opened from the medical faculty, where I said, my God, I'm only learning about consequences of something, and I'm describing, it was glomerulonephritis, kidney disease, and I really, the text on the reasons on how it will work, it was very short, one paragraph, 10 lines, and then everything around. And I intuitively knew that, well, of course, I can't take that as an answer, and that's when I started reading Ayurveda. That's when I started reading about bioresonance, about different treatment modalities. Although being a very serious Western medicine student. And then somehow in life, it connects in the end.